Hi everyone, thank you for joining our Kind²Mind Lunch and Learn. Just going to give it a second for everyone to join before we get started. Let me just go for this one. Hi everyone, for everyone who is just joining, we're just going to give it, actually it's 31, so let's just get straight in. So my name is Bethany, I'm the Marketing and Comms Manager here at Big Give, and I'm delighted to have you all here for our first Lunch and Learn Kind²Mind session. Today on the call, I have the lovely Francesca from Student Minds, Dan from The Listening Place, and Charlotte from Mental Health UK, and all of them I'm sure will introduce themselves again to you, but they'll be sharing some really exciting things about their projects. And just before we get started, a little bit of housekeeping. You'll see a chat box in your Zoom panel. You can set this to everyone, and please feel free to introduce yourself here or ask any questions or thoughts throughout the webinar. There is also a Q&A box at the bottom of your Zoom panel. You can also use this to ask some questions, and we'll make sure to pick them up during or at the very end of the session. If for any reason you do need some captions, at the bottom of your Zoom panel, you should see a caption button. You can set a live transcript so you can see that throughout the webinar. And just an FYI as well, that this webinar is being recorded and will be available to see on our YouTube channel after the session. And of course, if you haven't checked it out already, a little bit of a shameless plug, our Kind²Mind campaign is running right now, and you can go visit it at biggive.org and see some of the amazing charities taking part. And of course, the three I have with me are also going to be there. So let's get straight in. I'm going to pass on to Student Minds.
Thanks, Bethany. So hi, everybody. My name is Francesca Coleman. I'm Head of Programmes at Student Minds. I'm just going to give you a little bit of an overview and a flavour into who Student Minds are over the next 5 minutes or so. We're the UK's student mental health charity. We want a world where no student is held back by their mental health. As the slide shows, 1 in 3 students we surveyed in November 2022 reported having a poor mental health and wellbeing. We're here for all students at university, regardless of their age, gender, mode of study, background. We take the most inclusive approach we can to empowering students, to working with student communities to create a better environment for everybody. The slide here shows that there's many factors affecting student well-being and mental health. But just to talk a little bit more, I guess, to bring it to life a little bit, take the cost of living crisis that we're all living in at the moment, for example. Students are increasingly struggling and having to think about how they juggle paid work, studies, struggling to heat their homes, having to make the choice between going into university to attend lectures or not at all because of even something as small as a £2 bus fare when you've only got one commitment on campus can be the difference between eating that day or not. Increasing loneliness as students are cutting back on socialising. All of these things are having a negative impact on mental health. We know, for example, that those in private accommodation are cutting back on food or other essentials just to afford rent. So just that, I think that just brings to life a little bit just about something that we're all experiencing, what that is for individuals who are in that situation of being at university. And unfortunately, the needs of students are too often overlooked. We're all familiar with the current challenges facing the NHS, but we know just how much that acutely is affecting students with their mental health challenges. As the slide here talks to, many universities feel that they need more resources and training to respond to students in distress and understand where they need to step in and perhaps create that bridge between and create those resources and support structures to support students before or even during their receiving help from the NHS. It's quite terrifying that a quarter of students don't know where to get mental health support at their own institutions. So how can information be made more available, and how can we enable that whole institution to understand the importance of mental health and wellbeing? We can, as an organisation, we challenge the health sector, the higher education sector and government to make student mental health a priority. The situation as it is at the moment should not be this way. As we say, we want every student to have the mental health support they need to achieve their goals. A little bit more about what does the Student Mind actually do? Well, first of all, we empower students to look after their own mental health. We want to give students the mental health literacy that they need to understand mental health, to be able to talk about their own mental health and to go find the appropriate support. For example, Student Space is a free-to-use platform that we developed initially in response to the COVID pandemic, but we've now transitioned that over to be a free online space that holds psychoeducational materials for students and a directory to university support services that is accessible 24/7. There is no charge. We encourage universities to signpost to it as a resource for students as well as other organisations. And that platform contains information to help students navigate through the uncertainties of student life. We have grand plans for that platform to further develop the content that exists on there, which is all co-created with clinicians, and some of our plans include creating more tailored content for who are more at risk of experiencing mental health difficulties or challenges whilst at university. We run workshops that enable students to support friends and each other whilst looking after their own well-being. As I say, we want to give people that health literacy and that confidence to talk about mental health, and sometimes feeling confident just to reach out to a friend or a peer to ask them if they're okay, not to assume a role of a counsellor, but to be able to be that kind of key signposter. And the way that we do that is working through and empowering staff and within universities and student unions to run their own workshops. We have a number of different training packages that we do offer, such as look after your mate training. We have over 600 members of staff within universities and students across the UK that have been trained through our training programmes. And again, this is an area of real kind of potential and growth for us that we want to invest in more to understand how we can equip, as I say, staff and students with the knowledge and skills that they need. We create spaces for students to be able to tell their stories. It's really important for us to understand the experiences of students and embed those in all of our work. As you can see here on the slide, we have the story of Billy, who struggled with his anxiety during his first year at university, and the cycle that he fell into as a result of not attending lectures and hiding away. But after that step out and kind of thinking about how he could attend and being able to attend therapy and accepting his mental health struggles, it also empowered him to volunteer with Student Minds, to help run a podcast about male students' mental health, and to be able to tell his story to hopefully inspire others and to bring that sense of comfort and support. We run a blog, which is one of the UK's biggest student mental health blogs, which is run by students in a voluntary capacity to encourage others to share their stories and to feel that sense of togetherness. A huge area of our work is to work with universities to support them to improve the whole community, and that encompasses staff and students to really think about the role of mental health and wellbeing for them. This is about creating long-term systemic change through the University Mental Health Charter. As you can see, that we have 61 universities who are part of this holistic support programme that are enabling them to think about their approach to mental health and wellbeing, and to see that as something that impacts across the whole university community. So everybody within an institution should be thinking about embedding mental health and wellbeing and understanding how that relates to their work, rather than it being the counselling service that's kind of pushed at the end of campus. We're really proud of this piece of work and the framework, what it stands for, and have ambitions to grow the number of universities that are joining up to that programme and making that public commitment to embodying that whole university approach to mental health. And finally, doubling back to creating that voice, that opportunity for student voice and the communities around them. We feel really proud and passionate about empowering the voices of students to give them that platform to advocate for themselves, but also for us to create spaces for them to do that. We have a student advisory committee that makes sure that we are guided by student voice in all of our own activities, but also we can go to them to ask their opinions, as well as creating opportunities for other students across our organisation and our activities. So we know that our vital work does make a difference. And for example, we know that there is a reduction of the number of students who experience mental health difficulties through some of our training programs. We're striving to collect information about our impact and to be able to tell the story of the outcomes and the change that is achieved through our work. So I think this is just a kind of final opportunity for me to say, like, for anybody that can support Student Minds and those who already support us, their support is hugely appreciated to us as an organisation and really is enabling us to reach and support more students within the higher education environment. And together, hopefully, we will ensure that no student is held back by their mental health. Thank you very much for giving me this opportunity to speak for everybody.
Thank you, Francesca. That was a really insightful and interesting just presentation. And I mean, I know that particularly as we've kind of come out of the pandemic, I know a lot of charities have stated that it's had a really long and lasting effect on their beneficiaries and the people that they support. And I'd be really just interested to know if you saw that affect the number of students that particularly were referred to your organisation, and if you've seen that decrease or increase since then.
So I guess a really good example is Student Space, so that platform that I talked about with the free psychoeducation resources. The number of individuals that are visiting that platform, we haven't seen the numbers decline since we've, I guess, started to move away from the pandemic. Whilst we've done a huge audit of our content and started to shift the references to the pandemic away, we can see that it's still a platform that is very much needed for students as a place to navigate to get that trusted information, objective information about kind of mental health, but also I guess the different challenges that an individual might experience whilst at university, and then to have that onward signposting, particularly to other organisations that can perhaps provide more tailored support. We did a survey last year and found that it was still for many students, it was something like a fifth of students, the pandemic was still having a negative impact on their mental health. And we can see other aspects of how kind of coming out of the pandemic is still having that long-term impact. For example, as we kind of look at the move to online learning and perhaps now then overlaying the cost of living crisis, we can see that many students are perhaps having, as I said, choosing whether to attend their lectures or seminars in person or not. But that ripple effect of what that non-attendance means, so that lack of opportunity to build networks, to feel more part of a community, to build relationships with academic staff, and how that can be a real negative impact on somebody's experience, but also their ability to learn. I think the pandemic still isn't over for many students, and that long-term impact of that disruption to their education still kind of shines through.
Yeah, that is really interesting, actually. And I can see a question here that's just come into the chat, and it says, do you know any common signs to look out for core mental health that can help us spot when we might need to find that support?
I think some of the kind of pointers that we give through some of our training is that, you know, if you're looking out for, say, an individual that you're in kind of close contact with, for example, a friend that you might live with, looking for basic signs and kind of changes to behaviour. So somebody perhaps becoming a little more withdrawn or kind of changes to mood, and feeling that you don't actually have to be the person that will provide them that long-term support, but reaching out, asking that kind of basic question of how are they, but also being armed with information of where you can signpost to. So particularly in a university environment, what is the kind of main route into the support services that are offered by the university or the students' union? How do you get in contact with them? How do you enable somebody to just take that first step? It may be that it's a peer on a course and you've noticed that they're at that kind of issue of non-attendance, they've stopped engaging as much with their groups. And as I say, that change of behaviour is a really good indicator.
That's great. Thank you so much. With that, I'll pass straight on to Dan and Sarah from the listening place.
Everyone see my screen?
Yep.
Excellent. Just put it into presentation mode. So I'm Dan from the Listening Place. I'm the head of fundraising and comms there and a volunteer. And Sarah, who's just gone off camera, is our CEO. And we were just going to give you a brief kind of introduction to our charity, the Listening Place. So we're a charity with a single service, and that is to provide free, face-to-face, ongoing, 100% confidential support for people who are feeling suicidal. All of our support is delivered by highly trained volunteers, and it continues for up to a year. To give an idea of the kind of breadth and scale of the issue, in the UK, we're still losing someone to suicide approximately every 80 minutes. And I think as of the data for 2020, it was around 17 people every single day are taking their own life on average in the UK. It remains the highest cause of death for all men under the age of 50 and all adults under the age of 35. So considering the amount of press attention it gets, I think it's actually a much bigger issue than people might realise. And the problem that we were kind of set up to address and the issue that we identified is in the UK, there's something we call a revolving door and gap in services. And I'm going to describe this briefly, and it's based on coroner's reports, and it's based on the feedback from our own visitors. And usually when somebody makes a suicide attempt, if they survive, they will go to A&E, and they will usually be very quickly discharged from A&E. They will have a brief check over from a psychiatric liaison team, but in 95% of cases, they are referred back to their GP within 24 hours. So you can imagine you've gone on this quite traumatic journey to deciding you want to take your own life, and then you push back to your GP quite quickly. Unfortunately for GPs in this country, there's a very limited number of options available to them. There's medication, which works excellently for some people, and medication is actually at its highest use since this data was recorded, or there's IAPT services. IAPT services are NHS mental health services, and or talking therapies. Most of them use something called cognitive behavioral therapy. There's a couple of issues with IAPT services in this country. The first one that many people will be aware of are the waiting lists. And we have some visitors who have waited 16 weeks to get onto a talking therapies program with the NHS. The other issue is that they often screen out people who are too high risk. So if you go to a IAPT program and say, I'm feeling suicidal, there's a good chance that you may be pushed away from the service. The same applies if you have an addiction or if you have a diagnosis of borderline personality disorder. So unfortunately, a lot of people are engaging with services which are inappropriate for them, and that means usually they disengage from services and make another attempt. And this is highlighted by the fact that in 2018, I think it was only 50% of the people who took their own life that year had been in contact with any mental health services at the time of their attempt. So we've got a system that doesn't appear to be working very effectively in terms of reducing suicide. So we proposed a different approach. I don't know if Sarah wants to take over at this point. Oh, I can't hear you. No. Should I'll just go ahead, I think. So we proposed a different approach of free, face-to-face, ongoing, confidential support for people who feel suicidal. It's a new type of service. So we support the NHS, but we remain independent from it. We now receive approximately 600 referrals every single month for people who are feeling suicidal. We get 70% of those referrals directly from the NHS. And our intention is never to try and replace the NHS, but we are there to support them, and we can help ease some of the pressure on their own waiting lists and support people quickly. We have professional expertise, but it's a scalable and low-cost model. So as I highlighted, all of our support is delivered by volunteers, which means there's a huge potential workforce. But we also have a mental health advisory panel made up of mental health professionals, psychotherapists, psychologists, who can provide professional supervision to our volunteers. We provide consistent, ongoing and dependable support. So you will be supported by the same volunteer. And I think that's quite important when a lot of our services around suicide are phone lines or centralized digital kind of offerings. We're offering the possibility to build a relationship with one person. and that person will know your story, so you're not going to have to reshare your pain or your trauma at any time. We explore suicide confidentially, so we actually put our confidentiality policy above our safeguarding policy. We're able to do that because we only support adults who meet the threshold under the Mental Health Capacity Act. But a major concern for people who are feeling suicidal is often that if they say that they're feeling suicidal, they're going to lose their job, they might lose access to their children, that, you know, they're going to be even institutionalized, despite that being incredibly rare these days. Yeah, so we offer them complete confidentiality, which gives them the confidence to open up about what's really bothering them. And responsive when people need us most, so we don't use a waiting list. We aim to contact every referral within 24 hours and offer a first appointment within 7 days. We've gone from supporting a couple of hundred people to 5,500 people a year, and that's still true. And that's something we intend to stick by. Oh, Sarah, can we hear you now? Still can't hear you. I'm going to carry on. So this just highlights our referrals over 6 years. As you can see, there's been a real increase in the number of referrals we get. It's about 600 a month now from 150 referral partners. Many of them are the NHS, but there are other charities as well as other public sector organisations and organisations like British Transport Police. So wherever there's somebody who may present as suicidal, that's where we aim to get our referrals from. And since the pandemic, you can see that there's been about 100% increase in the number of referrals we get. Whether that's directly the pandemic or whether it's because of our increased impact, it's not entirely clear, but there's definitely been an increase in demand. Just really quickly, so we've had 21,000 referrals since we've opened, 3 centres in London, 630 active volunteers, and then we're now delivering up to 150 appointments every day. So we opened in 2016 and we've grown quite quickly. We've also been quite effective at reaching some at-risk communities. So the LGBTQ+ community is overrepresented in our data. And we see a high proportion, which may be of interest to student minds, a high proportion of 18 to 30-year-olds. They actually make up 47% of all our referrals. That was a number which increased after the pandemic. So yeah, they make up the large proportion of all our referrals. We also get 40% of our referrals are men, and that may seem like a low figure, but compared to other services, it is actually quite good. For example, IAPT only have 32%, and it is an issue and a struggle for mental health services to attract men to their services because they may not have that same type of help-seeking behaviour that we see amongst women. This just captures really quickly the kind of the amount of people we've supported and the amount we've lost to suicide. So everybody we support is suicidal, somewhere from low risk to having recently made an attempt. We've had 21,000 referrals and we've lost 16 people to suicide, and every one of those is a tragedy, but it does demonstrate that our service is working for an awful lot of people. So quickly to highlight impact, I'm not sure how I'm doing for time. Just to quickly highlight impact, we measure everything we do. We have the Columbia Suicide Severity Rating Scale, which allows us to determine how suicidal somebody is when they first come to our service and how suicidal they are when they leave. And we can see that there's highly significant reductions after just 3 months. And there's also highly significant increases in feelings of support. We've also published this data recently in the Journal of Crisis Intervention and Suicide Prevention. So we have robust data that suggests our support is effective in achieving a reduction in suicidal feelings. And these are just a few quotes which kind of highlight how people feel about our service. And we get a lot of these, and I think sometimes they can be more impactful than the kind of data points.
Thank you, Dan. Really good presentation. And I think, whilst you have showed that there is a gap in the services, it's great to know there's organisations like yours that are seeking to kind of address that gap and get people the support that they need. We've had a couple of questions for you to coming through the chat, actually. The first is, what should you do if someone tells you that they are thinking about suicide, and how can you encourage them to get in touch with the Listening Face?
Sorry, you just cut out for a second there. Could you repeat that question?
Yeah, so it says, what should you do if someone tells you they are thinking about suicide? And how can you encourage them to get in touch with you? So I assume that's from like a family or friend has told someone they want to
I mean, yeah, in terms of the support you can provide in that moment, I would emphasize, and I think Sarah would agree, to try and respond to that situation calmly. It can be really distressing to hear somebody you care about is thinking about taking their own life, but I would encourage you to respond calmly and to try and have a conversation about it without shying away from the fact that they're thinking of taking their own life. You're not going to persuade them to do it by discussing it. So if you can discuss that calmly, it's actually more helpful than saying, don't do it, for example. In terms of signposting to our service, we have a referral form which I can put in the chat, which only takes about 5 minutes to complete. I would always advise, if you are with somebody who you want to refer to a service, try and go through the referral process with them. If you just give them a leaflet or tell them to call the number, there's a very high chance that they won't do that because there's so much going on in their life already. Whereas if you can sit with them while you make the referral or make the referral on their behalf, I think it can often be much more helpful.
That's great. And do you provide any support to the listening or helping volunteers that you work with as well?
Yeah, we have an extensive system of support for listening and helping volunteers. So each volunteer will have a supervising volunteer on their shift who they will, after each appointment, they will debrief with them. They can raise any issues or any difficulties they've found in the course of their appointments. We also have a volunteer support team that's available 7 days a week. And that is available to all of our volunteers, and they can discuss something related to TLP, or it doesn't even have to be related to TLP. It can be something that's bothering them. So we place quite a strong emphasis on supporting our volunteers because obviously they're having conversations that most of us wouldn't choose to have.
Thank you. The final question here at the moment is, how do you increase your visibility beyond referrals?
Right. Well, this is a tricky one because we want to stick to that and not having a waiting list, being able to offer an appointment within a week. So the way that we've gone about our growth is adding referral partners, because that would allow us to forecast, how many referrals we're likely to get and to ensure we have the volunteers in place, the space, and the money to be able to support that additional number of people. So we actually fly under the radar a little bit. And I think we're committed to continuing to do that because it allows our service to be unique in that you get to see the same volunteer, it gets to be face-to-face, and it gets to be, you get to be contacted within 24 hours and have an appointment within a week. So in terms of our visibility, we're actually more keen on limiting it and sticking to our fundamentals than we are about having a big kind of bang where everybody refers themselves to TLP.
Thank you. And I can see some more questions have come in, but I'm going to pass on to Charlotte and then we can ask the remaining questions at the end.
Hi everyone, so I'm Charlotte and I'm from Mental Health UK. I work in our young people's programs team, so I'm just going to tell you a little bit about Bloom, the program I work on, which is a program supporting young people in education settings. So in case you haven't heard of us, Mental Health UK are actually a partnership of 4 charities who work across the United Kingdom. So we're quite unusual in that we have reach across all 4 nations. So I have colleagues working on the same programme in Scotland and Wales and Northern Ireland, which is really lovely. And Bloom is our programme which supports young people aged 14 to 18 in schools and colleges. So the programme is built around mental health resilience and supports young people at a real critical time in their life. So I'm sure most of us as adults can remember that when we were 14 to 18, things were pretty difficult. We were experiencing a lot of physical and mental changes, and at the same time, huge amounts of change in our education journey. So as young people move up to their GCSEs, they can find that the increase in workload and stress really affects their mental health. Obviously, as we know, at the moment, there may be many other issues exaggerating that in the home. The cost of living crisis is also having a huge impact on young people. So we're there to provide resilience skills and workshops to support young people. But crucially, what we're also trying to do is really provide training for school and college staff so that they're able to take that support forward in their setting independently. Because what that means is that then we don't just help the 30 young people that we meet in one workshop. There's an ongoing legacy of support in that school or college for those young people. So young people are being supported now and in the future as well. So give you a little bit of background, tell you the Bloom story. So Mental Health UK are specialists in providing preventative mental health interventions. So we're kind of here to try and stop people getting to the point that they might get to when they access services that Francesca's been telling you about and that Dan has been telling you about, because sometimes just the right tools at the right place and the right time can provide support for someone so that their mental health doesn't deteriorate in the future. We know that sadly, most mental illnesses do tend to start in late adolescence. 75% are diagnosed by the time a young person is around 18. And when you think about the context of this hugely critical time that they've just been through, perhaps that isn't surprising. So we designed Bloom in 2019. We've already talked a bit about the pandemic. None of us had any idea what was coming at that point. But what's been interesting actually is to see that how a lot of our content has been evergreen and young people are still reporting exactly the same stressors. So we did consultation with around 300 young people and asked them what the most significant threats to their mental health were and what support they felt they needed in order to be able to kind of be more resilient in tackling and addressing those stressors. So the outcomes were really interesting. I'm just going to show you some of them here. We all had lots of preconceptions about it's all going to be about social media, right? But it wasn't. And actually a lot of what young people told us was having the biggest impact on them were things in their education environment. So for both the 14 to 16 and 17 to 18 age groups, exam stress, 36 and 38% of those young people we spoke to said that those were the most significant threats to their mental health, the anxiety that was being caused by their exams. For the younger age group, there was also a fair amount of struggle with friendships, bullying, conflict, social pressure. Again, I think if we all cast our minds back to that period in our own lives, I know I had huge challenges with friendships at that age as well. And in the 17 to 18 age group, there were also struggles with kind of juggling workload, studies. And by that point, many young people had part-time jobs and were telling us we're just overwhelmed. You know, we can't cope with everything that we have on our plate. We can't manage our lives. So those were the challenges that they told us were affecting them. So we went away and built the Bloom programme around that. And while we have workshops that kind of specifically target those stressors, all of our workshops are built on resilience. And we make that our focus because absolutely everyone can apply resilience skills to improve where they sit on the mental health spectrum. So perhaps if a young person comes to us and they're just sort of between crisis and struggling, or whether they're perhaps between unsettled and thriving, depending on their circumstances, they can positively support their mental health and move towards the green end of that spectrum. I think what we also intended and what we've really seen in delivering our workshops is that this also means that all young people come to our workshops as equals. And I think, you know, sometimes Francesca was saying you might have students who kind of like the students who see the counsellor and then the students who perhaps are kind of regarded as mainstream and normal. And we really want to get past that stigma. It can be a very stigmatizing experience for young people in school when they have to leave lessons to go and see school counsellors or go to CAMS appointments and things. So all young people can come to a Bloom workshop, discuss their experiences as equals, and they can all apply resilience tools. So we aim to provide them with coping strategies, which they can use right now, but which will also serve them into adulthood as they move into the workforce. And we also really hope to kind of change the conversation in schools, and just ensure that school staff and college staff feel able to support as well. So far we've reached 330,000 young people since we started the programme in 2019, and that's through our workshops, but also crucially through the ongoing delivery by educators that we've trained. So we've trained 4,100 educators, teaching assistants, professionals across the education profession. We've delivered workshops in 80 counties across the UK now, and we tend to deliver more than around 600 face-to-face workshops in schools and colleges in an academic year. So we've got quite big reach, and we hear the same stories coming through all of that. So my colleagues have already talked a bit about the need that we're seeing in young people. This has just got so much worse, unfortunately, since 2019. So we've really seen that our programme has been more needed than ever. So the number of teenagers experiencing a mental health difficulty has increased from 1 in 6 to 1 in 4. Childline have shared that the number of young people seeking counselling for exam anxiety has almost doubled in the year 2021 to 22. And we also know from the NHS that teachers, interestingly, are often the primary point of contact for young people who are seeking assistance with their mental health. But those teachers don't necessarily feel equipped to support those inquiries, that request for support, which is understandable. Imagine if you train as a maths teacher and suddenly you've got all these young people saying, I'm really struggling with my mental health, what do I do? They're not necessarily provided with training. So we've really seen a lot of results just from teachers and other school and college staff feeling able to support, feeling that they can say to young people, yes, we've got these tools, why don't you try this? And of course, as has already been discussed this morning as well, huge numbers of referrals being made to the CAMS system at the moment, quite long waiting times. But I think what we're really hoping is that by providing these young people with some resilience tools, they're given that support so that they can support themselves independently, and perhaps they won't get to a point where they need that referral in future. So to give you a little bit of background about our impact, so we use the Short, Warwick and Edinburgh mental wellbeing scale to measure the difference that we're able to make with young people. So you can see the kind of points increase, that the overall improvement in their well-being. What I would caveat this with saying is that this is after 8 weeks. That's the sort of length of the intervention programme that we offer. So this is actually really positive just for 8 weeks, but we hope that young people will obviously continue to improve after we don't have that contact with them anymore. And there's some survey responses that we've collected here as well. So after taking part in Bloom, 76% of young people said that they felt well equipped to tackle their life stressors thanks to the tools that they've been given, which we were so happy to see. And also, and I think this is so important as well, and it's really easy to underestimate, 84% felt that they knew where they needed to go or who to speak to if they needed help with a problem. And that can make a huge difference as well, because, you know, as Francesca was saying, loneliness can be a huge factor. If someone feels like they don't have someone to talk to, then their mental health is often going to really deteriorate. So it's been good to see those responses. And just thought I'd share with you a quick case study from a college in Wales. And they kind of wanted to try out Bloom and see how it went, and then see if it was something that they felt able to roll out to their whole college community. So they piloted it with one group at level 2. So we sort of did the sessions at the start of the year over 8 weeks. And what was really interesting to see was the kind of pathway of that level 2 group compared to the pathway of the other equivalent level 2 group. So the group who'd taken part in Bloom, they were much more cohesive. They were able to kind of form these friendships. They'd been given tools to resolve conflicts between them, so they were able to sort of stick together and talk about things. And when they experienced challenges, bumps in the road, when their course got difficult, they had their Bloom tools to go back to, they had strategies, and crucially, they had each other. So staff noticed that they were a lot more resilient, and that their outcomes were better. And at the end of the academic year, their academic results were actually better too, which when you think about it isn't surprising because they were healthier, you know, their mental health had been supported. Bridgend College in Wales now they offer Bloom to all their students, which has been really great to see. They've been running it for 3 years now and continuing to see really good results. So we don't stop there though. We've got this great programme, but we also want to keep learning and adapting to what young people need. So we've recently created workshops to support young people struggling with anxiety and low mood and depression. And some of that is about kind of destigmatizing anxiety, what it is, what we're experiencing, why we experience anxiety and what we can do about it. And with low mood and depression, kind of perhaps highlighting the differences between low mood and clinical depression, when we need to seek support and what things we can do if we're experiencing low mood. We've talked a bit about the cost of living crisis already. We're also developing some new workshops to support young people with financial resilience, which is really about the links between money and mental health. Again, something that Francesca touched on as being a key issue for students. And again, we're really hoping that that early intervention while young people are still at school will really support them as they move into adulthood. We're doing ongoing research into how we can support parents and carers to better support their young people. We've got conversations guides for having conversations with young people about mental health, and we're continuing to research what we can do there. And we are committed to our ambitious target of supporting 500,000 young people by 2025. So that's us, that's Bloom, that's what we're working on in young people's programmes at Mental Health UK at the moment. And if you wanted to find out more about our programmes and what we're offering, there's a sign up here so you can get news from us, and yeah, then you'll receive emails telling you what we're doing at the moment and how we're improving the lives of young people. Thank you.
Thank you, Charlotte. And I think it's evident from all of your presentation just how important it is to be supporting our young people and making sure that they have all of the support they need just as crucial areas of development in their lives. And we've had a few really good questions come in actually from that. And the first is, do you take into account someone's cultural and racial background as well as their socioeconomic background when delivering your services and looking into how these could also affect a young person's mental health?
Yeah, I mean, because we deliver to such large numbers of young people, we just try to make sure that our programme is as universal as possible. So the scenarios take into account experiences of young people from different environments. We do tend to focus our engagement on areas of socioeconomic deprivation because we know that young people tend to struggle in those environments more. What sometimes makes that harder is that the schools in those areas are so under pressure already that it's hard for them to kind of make the time to take part in our workshops. But we're absolutely there in those areas and offering that support. And we do also, so if we're, for example, engaging with very particular groups, we do offer our programme in special educational needs settings, which is quite unusual for universal programmes. So we adapt as necessary. So if we need to adapt to a particular environment, a particular group of young people, then we'll look at that before we deliver and see how we can make sure that it's suitable for those young people.
Thank you. And we have another question here, and it says, it can sometimes be heavy thinking about the issue of poor mental health. What are the panel most optimistic about the future and in their respective fields of work? So I think anyone can jump in here and answer this.
I'm happy to jump in first. I think in my role, I'm very privileged to go out to universities to meet with panels of students and staff to understand how they're trying to create that big institutional change that I spoke to. And it can be really inspiring to hear the passion of individuals who want to make a change within their institution, the work that they're doing, the new initiatives they're setting up, the evidence they're collecting to understand, is this working? But also the openness of staff and kind of leaders within institutions about addressing where they are experiencing challenges. Rather than pitching a sales pitch to us, we really encourage people to be honest and to talk about where things haven't perhaps worked and where they need to kind of invest more. And I think when we're so often thinking about all of the things that aren't working, or we're kind of feeling quite overwhelmed about the statistics, hearing from those who are really passionate about making that change is really just gives you that fire in your belly to go out and do more.
And just to
Yeah.
add as well.
Oh, sorry, go on, Charlotte.
We'll come on to you, Dan, as well. I was just thinking that wouldn't it be nice to live in a world where it doesn't feel heavy to talk about mental health as well, you know, where it's just okay. And I really think that the more we continue to destigmatize it, the less people will struggle. So that's a huge part of all our work, I think.
Yeah, I was going to say the thing that makes me feel optimistic is obviously some of the feedback we get, but also we had 122 volunteer applications like a month ago. So as much as it's, you know, we're working in a heavy kind of area, I think it is heartening to see the amount of people that want to help. Just got to make the resources available to them that allow them to help effectively. Yeah.
Thank you. And we're actually right on kind of 45 minutes. So I'm going to end the webinar here, but I want to thank you all again for taking some time out of your lunch to join us for this session. It was really insightful and I definitely took a lot of learnings away from here. Just going to add the Kind²Mind main page into the chat as well. So if you do want to have a look at some of these projects in a bit more detail and a range of other amazing causes, you can do so. But thank you all again and have a lovely rest of the day.